A man walks into a hospital in Philadelphia. It is 1866. The Civil War just ended a year ago. This man lost his right arm above the elbow from a cannonball fragment at the Battle of Gettysburg. The arm has been gone for 3 years, buried in a field somewhere in Pennsylvania. And yet, this man sits in front of a doctor, sweating, gripping the edge of the chair with his one remaining hand, and he says, "Doc, my fingers are on fire." Not the fingers on his left hand. The fingers on the hand he does not have. The hand that is rotting in dirt 100 miles away. Those fingers, he says, are clenched so tightly into a fist that the nails are digging into the palm. He can feel the nails. He can feel the heat. He can feel individual knuckles locked in place. And the pain is so vivid, so specific, so utterly real that he would rather lose the other arm than keep feeling it. So what do we actually know here? We know there is no hand. We know there is no arm. There is no skin to burn, no muscle to cramp, no nail to dig into any palm. The matter is gone. The atoms that once made up those fingers are scattered. And yet the pain persists, sharp and detailed, as if physics itself has made an error. That is our case. And I want to solve it tonight. Because this is not a medical curiosity. This is not some footnote in a textbook about unusual patients. This is a crack in the wall of something we all take for granted, the idea that pain is a thing that happens to your body. If pain can exist without the body part that is supposed to produce it, then we have been wrong about something very fundamental. The question is, what? Let us start where any good detective starts, at the scene of the crime. When you stub your toe, here is what you probably think happens. The toe hits something. That collision damages some cells. Those damaged cells send a signal. The signal travels up your leg, into your spine, up into your brain. The brain receives the message and goes, ouch, pain delivered. Simple as a telegram. And for a long time, that is exactly how people thought about it. There is even a name for this model. René Descartes, the philosopher back in the 1600s, drew this beautiful little diagram of a boy with his foot near a fire. And he drew a line, like a thread, running from the foot all the way up to the brain. Pull the thread, ring the bell. That was his theory. Pain is a direct line, stimulus at one end, experience at the other. A pipe, a wire, a one-way street. And look, for most of everyday life, that picture works well enough. You touch a hot stove, you pull away, it hurts. Cause and effect. Very satisfying, very mechanical, very Descartes. But if that picture is correct, then our phantom limb patient is impossible. The wire has been cut. The arm is gone. There is nothing to pull the thread. And yet the bell is ringing, not quietly, not vaguely. It is ringing with the specific, detailed, excruciating pattern of fingernails digging into flesh. So either the patient is lying or the model is wrong. And I can tell you thousands of patients across hundreds of years are not all lying, which means the model is wrong. Good. Now we are getting somewhere. Let us look at the first suspect. The obvious one. The one every reasonable person would suspect first. When a surgeon amputates a limb, what happens at the cut site? You have got these nerve fibers, right? Bundles of them, running through the arm like cables through a wall. And the surgeon cuts right through them. Those cut nerve endings do not just quietly seal over and go to sleep. They do something strange. They try to regrow. They sprout little tangled knobs of nerve tissue at the stump. Doctors call these neuromas. And here is the thing about neuromas. They are irritable. They fire randomly. Little bursts of electrical activity shooting up toward the brain for no external reason. No stimulus. No toe stubbing. Just a damaged nerve ending misfiring in the dark, like a broken spark plug. So there is our first theory. Phantom limb pain is just noise from damaged nerves. The neuromas at the stump are sending garbage signals up the line, and the brain, doing its best, interprets those signals as pain in the missing hand, because that is what those nerves use to report on. Case closed? Not so fast. Because here is what does not fit. Doctors tried cutting the neuromas out. They went back in with a scalpel and removed those little tangled nerve endings. And sometimes the phantom pain went away for a while, but then it came back. So they cut higher up the nerve. Same result. It returned. Some surgeons, in desperation, cut the nerve all the way back to the spinal cord, and still, in many patients, the phantom pain came screaming back. Think about that. You have severed every physical wire between the stump and the brain. There is no nerve left to send a signal. And the patient still feels their missing hand burning. The neuromas were a clue, sure. They contribute something. But they cannot be the whole story. Because when you remove every neuroma, every nerve fiber, every possible source of signal from the periphery, the pain endures. Our first suspect has an alibi. Something else is happening. All right, let us slow down. Before we chase the next lead, I want to make sure we understand what a nerve signal actually is. Because people talk about nerves sending pain as if they are sending a package through the mail. Little envelopes labeled pain traveling up to the brain. That is not what happens, not even close. A nerve signal is an electrical event. More specifically, it is a wave of voltage change that travels along the membrane of a nerve cell. Here is how it works. The nerve cell, at rest, has a slight electrical imbalance across its outer membrane. The inside is a bit more negative than the outside, about minus 70 millivolts. That is 70 thousandths of a volt. Tiny, smaller than a hearing aid battery. But when something stimulates the nerve, little protein gates in the membrane swing open. Sodium ions rush in. The voltage flips. Positive inside, negative outside. And that flip triggers the next section of membrane to flip, which triggers the next, which triggers the next. A domino cascade of electrical reversal, racing along the nerve fiber at speeds anywhere from about 0.5 meters per second in the slowest fibers to over 100 meters per second in the fastest. This is physics, pure and clean. Ion concentrations, voltage gradients, membrane capacitance, signal propagation. The same equations that describe current moving through a submarine cable describe current moving through your nerves. Lord Kelvin figured out the math for telegraph cables in the 1850s. Hodgkin and Huxley worked out the nerve version almost a century later, in 1952, and won the Nobel Prize for it. But here is the critical thing, and this is where most people get tripped up. The signal itself carries no label. The electrical impulse traveling up from your toe looks exactly the same, physically, as the impulse traveling up from your fingertip. Same voltage spike, same ion movement, same waveform. If I intercepted the signal in your spinal cord with an electrode, I could not tell you whether it came from your foot or your hand. I could not tell you if the original stimulus was heat, pressure, or a pinprick. The signal is just a pulse, a blip of voltage change. That is all the nerve can do, fire or not fire, and maybe fire faster or slower. But the signal itself does not contain the word pain any more than a doorbell contains the identity of the person pressing it. So who decides it is pain? Where does the label get attached? You already know the answer. The brain. But knowing that the brain is involved is not the same as understanding how. And this is where the investigation gets genuinely strange. In 1965, two scientists named Ronald Melzack and Patrick Wall published a paper that changed everything. They called it the gate control theory of pain. And the key insight was this: pain is not a one-way telegraph from body to brain. There is a gate, actually several gates. In your spinal cord, where nerve signals arrive from the body, there is a processing station, a checkpoint. And at that checkpoint, signals can be amplified, dampened, modified, or blocked entirely before they ever reach the brain. Think of it this way. Imagine a security desk in a building lobby. Messages arrive from all over the building. But the security guard does not just pass every message straight up to the boss on the top floor. The guard looks at the message, checks it against other information, and decides, does this go through? Does it get flagged as urgent, or does it get tossed in the trash? That is what happens in your spinal cord. Signals from the body arrive, but they pass through a network of other neurons that can dial them up or dial them down. And here is the remarkable part. The brain sends signals back down to the gate. The boss on the top floor can call the security desk and say, hey, ignore messages from the third floor for a while. Or, anything from the basement, treat it as an emergency. This is why rubbing a sore spot helps. You bang your shin, and instinctively you rub it. The rubbing activates touch fibers, and those touch signals partially close the pain gate in the spinal cord. The pain signal still arrives, but it gets turned down at the checkpoint. The physics did not change. The stimulus is the same, but the gate modulated the signal before it reached consciousness. And this is why soldiers in battle sometimes take horrific injuries and feel nothing until hours later. The brain, in a state of extreme alertness, sends signals down to the spinal gate that essentially say, suppress everything, we are busy surviving. The wound is real. The tissue damage is real. But the pain experience is deferred, postponed by the brain. This is already remarkable. Pain is not passive reception. It is active construction. The brain is involved not just in reading the signal, but in shaping it before it even arrives. But we have not solved our phantom limb case yet, because gate control theory still assumes there is a signal coming from somewhere in the body. It explains how the brain filters and modifies peripheral signals. But in our patient with no arm, there is no peripheral signal to filter. The arm is gone. The nerves are gone. We cut them all the way to the spine, remember? So the gate has nothing to open or close for. And yet the pain is there. We have eliminated the periphery. We have eliminated the spinal cord as the sole processor. The trail leads somewhere higher, somewhere deeper. Let us go to the brain itself. And I want to take you to a very specific place. A strip of tissue that runs across the top of your brain, from roughly one ear to the other like a headband. This is called the somatosensory cortex. And it contains a map. Not a map of the world, a map of you, a map of your own body. Wilder Penfield, a neurosurgeon working in the 1930s and 40s, discovered this by doing something wonderfully direct. He had patients who were undergoing brain surgery while awake. The brain itself has no pain receptors, so you can operate on it with the patient conscious and talking to you. Penfield took a small electrode and touched different points along this strip of cortex. And the patients would say things like, I feel a tingle in my left thumb. Move the electrode a few millimeters. Now it is in my wrist. A bit further, my elbow. He mapped the whole body this way. Every patch of cortex corresponded to a specific body part. And he drew the result, this famous distorted little figure called the homunculus. It looks absurd. Enormous hands, a giant tongue and lips, tiny torso. Because the amount of cortex devoted to each body part is not proportional to size. It is proportional to sensitivity. Your fingertips get a huge territory. Your back gets almost nothing. This map is not a nice-to-have feature. It is your brain's fundamental model of what your body is and where its parts are. Every sensation you feel is ultimately an event in this map. When you feel your left index finger being touched, what is actually happening at the deepest level is that neurons in the left index finger region of your somatosensory cortex are firing. That is where the feeling lives, not in the finger, in the map of the finger. Let that settle for a moment, because it sounds almost too strange. You feel your finger because your brain has a model of your finger, and activity in that model is what you experience as sensation. The finger itself is just a source of signals that usually trigger activity in the corresponding patch of cortex. The finger is the informant. The cortex is the experience. Now, What happens to this map when the arm is amputated? Here is what you might expect. The region of cortex that used to represent the hand just goes quiet. No more input, no more activity. A dead zone. Lights off. But that is not what happens. Something much stranger occurs. The neighboring regions of the map start to invade. Remember, in Penfield's homunculus, the hand region sits right next to the face region. Strange arrangement, but that is how it is wired. After an amputation, neurons in the face region begin to grow connections into the now vacant hand territory. They colonize it. And what does this mean for the patient? It means that when you touch their face, they feel it in their face, yes, but they also feel it in their phantom hand. Stroke the cheek, and the patient reports a tingling sensation in a thumb that does not exist. A specific spot on the jaw maps to a specific phantom finger. You can literally draw a map of the missing hand on the patient's face. The hand is gone, but the brain's map of the hand is still there, still active, still capable of generating the full, rich, detailed experience of a hand in space, a hand that can feel heat and cold and pressure and pain, all without any hand at all. This is our answer, or the beginning of it. Pain does not live in your body. Pain is an event in your brain's model of your body, and the model can run without input from the actual body part. The cortical map does not need the hand to feel the hand. It just needs to be active. And after amputation, it stays active, partly because of invasion from neighboring regions, partly because of spontaneous firing in neurons that have lost their normal input, and partly because the brain's top-down predictions keep expecting the hand to be there, keep generating a hand-shaped pattern of activity, and when that pattern is disrupted or distorted, the result is pain. Let me say that differently, because it matters. Your brain does not sit passively waiting for pain signals from your body. Your brain actively generates a prediction of what your body should feel like, right now, in this moment. It constructs an expected state of your body, where your limbs are, what they are touching, what temperature they are, whether they are comfortable or strained, and then it compares that prediction against incoming signals from the actual body. When the prediction and the signal match, everything feels normal. You do not even notice. When there is a mismatch, a significant one, something between prediction and reality not lining up, the brain generates a correction signal. And sometimes that correction signal is pain. After amputation, the brain keeps predicting a hand. It expects a hand. But there is no signal coming back. The prediction says, hand, open, relaxed. The sensory return says nothing, silence. And that mismatch, that screaming gap between expectation and reality, generates pain. The brain is essentially saying, something is terribly wrong with the hand, because I am getting no confirmation that the hand is okay. And something is terribly wrong translates to agony. The fingernails digging into the palm? The brain's last prediction before the amputation may have been a clenched fist, a hand gripping something, and that prediction froze, locked in place. No new sensory data to update it. So the phantom hand stays clenched, permanently, and the brain generates the sensation of nails cutting into flesh, because the model says that is what a fist, clenched, that tightly would feel like. This is not psychology. This is not imagination. This is the physics of information processing in a biological neural network. It is as real and as physical as the electrical signal in a nerve. The voltage changes in cortical neurons are measurable. The remapping of cortical territory is visible on brain scans. The phenomenon follows predictable patterns, occurs in consistent percentages of amputees, somewhere around 60 to 80%, and has specific, reproducible characteristics. Let me push this one step further, because I think we have stumbled into something deeper than just a medical mystery. Consider your left hand right now, the one that is actually there, attached to your body, functioning normally. You feel it, yes? You can sense where it is without looking. You can feel the texture of whatever it is resting on. You feel its temperature, its weight, its position in space. Every bit of that experience is happening in your brain's map, not in the hand. The hand provides data, but the feeling, the conscious, subjective experience of having a hand is a construction of the cortex. Always has been, always will be. The hand is the territory. The brain's map is where you actually live. You walk around every day trusting that your experience of your body is a direct readout of reality. That when you feel your foot on the floor, you are feeling the floor. But you are not. You are feeling your brain's best guess about the floor, informed by signals from the foot, but processed, filtered, predicted, and constructed by 100 billion neurons doing something we still do not fully understand. The phantom limb patient is not experiencing something different in kind from what you experience every day. They are experiencing the same process, the brain constructing a model and generating experience from it, but with the unusual condition that the model has no incoming data to calibrate against. They are seeing the machinery laid bare. It is like watching a television that has lost its antenna signal. You do not get a blank screen. You get static, noise, sometimes even ghostly shapes. The television is still doing what televisions do, processing inputs and producing images. It is just doing it without a proper signal. The result is distortion, not silence. And pain without a limb is the brain's version of static. The model runs, the experience generates, but the calibration signal is gone, and what comes out is a distorted, often agonizing version of what should be there. I find this deeply fascinating, not because of the medical implications, although those matter enormously to the people suffering. I find it fascinating because of what it tells us about the nature of experience itself. See, we physicists spend our lives studying the outside world, atoms, forces, fields, waves. We have gotten extraordinarily good at describing what happens out there. But there is this other thing, this thing called experience, consciousness, the felt quality of being alive and sensing the world. And it turns out that even something as seemingly straightforward as pain, the most basic, most urgent, most undeniable form of experience, is not a simple readout of physical events. It is a construction, an inference, a highly processed interpretation made by a brain that is, at every moment, building a model of reality and presenting that model to you as if it were reality itself. The atoms in your hand are not in pain. Atoms do not hurt. Sodium ions do not suffer as they rush through a membrane channel. An electrical pulse traveling along a nerve fiber has no opinion about its journey. Pain exists at the level of the model, at the level of information processing, at the level where patterns of electrical activity across billions of neurons become something felt. We do not understand that transition. I want to be honest about that. We understand the physics of the nerve signal beautifully. Hodgkin and Huxley gave us equations that predict action potentials with stunning accuracy. We understand ion channel dynamics, membrane biophysics, signal propagation, synaptic transmission. The physics of the components is solid, but the physics of the whole system, the physics of how 100 billion neurons, each one doing nothing more than firing or not firing, each one obeying perfectly understandable electrochemistry, somehow collectively generate the experience of a hand on fire? We do not have that. Not yet. And phantom limb pain sits right at the crack in our understanding. It is the place where the physical and the experiential meet, overlap, and refuse to neatly separate. Let me tell you something that makes this even more interesting. I mentioned that the brain's map of the body, the somatosensory cortex, reorganizes after amputation. Neighboring regions invade the vacant territory. Face sensations bleed into the phantom hand. But here is the twist. The degree of reorganization correlates with the degree of pain. Patients whose cortical maps reorganize the most tend to have the worst phantom pain. Patients with minimal reorganization tend to have less pain or none at all. Why? Think about it in terms of signal clarity. If the hand region of the cortex is receiving clean, organized input from the face, it can at least produce a coherent, if misplaced, sensation. But if the reorganization is chaotic, if different face regions are sending conflicting signals into the hand territory, if the map becomes a mess of crossed wires and garbled assignments, then the brain's model of the hand becomes noisy, contradictory, confused. And confused models generate pain. Because from the brain's perspective, conflicting information about a body part is a danger signal. Incoherence in the model means something is wrong. Pain, in this view, is partly a signal about the integrity of the model itself, not just about tissue damage, not just about danger to the body, but about the coherence of the brain's own representation. When the map breaks, pain is what breaking feels like from the inside. There is an analogy from physics that I find helpful. In thermodynamics, we have the concept of entropy, disorder. A system at high entropy is disorganized, unpredictable, noisy. A system at low entropy is ordered, structured, predictable. And there is a cost to disorder. It takes energy to keep a system organized. When organization breaks down, when entropy increases beyond what the system can manage, the system degrades. The brain's body map is a low entropy structure. It is precisely organized. Each region knows what it represents. The signals are clean. The predictions are accurate. After amputation, entropy in that part of the map increases. The organization degrades. Signals become noisy. Predictions fail. And the subjective experience of that thermodynamic-like degradation, that loss of order in the model, is pain. I am not claiming the analogy is perfect. I am not saying phantom limb pain literally obeys the second law of thermodynamics. But I am saying that the parallel is suggestive. Pain may be what disorder in a self-model feels like. And that is a thought worth sitting with. Let me come back to our Philadelphia patient for a moment. The man with the burning phantom fingers and the clenched invisible fist. Given everything we have discussed, what would you do for him? If you are a doctor in 1866, you have nothing. You do not understand the mechanism. You can offer morphine, which dulls consciousness generally, but does not address the underlying model. You can try to distract, to soothe, to reassure, but the phantom hand keeps burning. Even decades later, when the physics of the nerve signal is well understood, the clinical tools remain limited. Because the problem is not in the nerves, the problem is in the model. And you cannot operate on a model. You cannot excise a prediction with a scalpel. Some researchers have tried a remarkably clever approach. If the brain's model is stuck because it cannot get sensory feedback from the missing hand, what if you fool the model? What if you give it fake feedback that the hand is there and relaxed? One technique uses a simple mirror. You place a mirror vertically in front of the patient, between their intact arm and their stump. The patient looks into the mirror from the intact side, and what they see is a reflection of their real hand, exactly where the phantom hand would be. Then you ask them to move both hands. Open and close the real hand. Relax the fingers of the real hand. And the brain sees what looks like two hands moving in sync, the real one and the reflected one, and for some patients, the phantom hand unclenches. The pain eases, sometimes dramatically. The mirror provides the visual feedback that the brain's model has been starving for. It is not real. The brain, at some level, must know it is a reflection. But the visual input is enough to update the model, to say, the hand is there, it is open, it is relaxed, everything is fine. And the model, updated, stops generating the pain of a clenched fist. This works because vision and touch and proprioception all feed into the same body model, and the brain weights visual information very heavily. Show it a convincing image of the hand being okay, and the model adjusts. The phantom relaxes. The pain recedes. Think about what that means. A flat piece of glass, a simple optical trick, no drugs, no surgery, no electrical stimulation, just photons bouncing off a mirror and entering the eye, and the brain rewrites its model. Pain built over months or years dissolves because the informational inputs changed. Not the physical body, not the nerves, not the chemistry, the information. If that does not make you pause, you are not paying attention, because it means pain is not fundamentally about tissue. It is about information, about the coherence of a model, about predictions matching or failing to match reality. Pain is an epistemic state, a state of the brain's knowledge about the body, and it can be altered by changing what the brain knows, or thinks it knows, even through something as simple as reflected light. Now I want to pull back and ask the big question, the one I have been circling around this whole time. If pain is not in the body, if it is in the brain's model of the body, then where does any sensation live? When you feel warmth on your skin, is the warmth in your skin? Or is it in the cortical pattern that your skin's signals trigger? When you feel the roughness of sandpaper, is the roughness a property of the paper or a property of your brain's interpretation? Physicists describe the world in terms of atoms and forces. There is no warmth in the equations, no roughness, no pain. There are electromagnetic interactions between the molecules of your skin and the molecules of the sandpaper. There are deformations of nerve endings. There are action potentials. There are synaptic transmissions. There are cortical activation patterns. At no point in this chain does the physics produce the quality of roughness as you experience it. The physics produces patterns, and you experience qualities. Where does the translation happen? We do not know. What phantom limb pain shows us with startling clarity is that the qualities can exist without the corresponding physical stimulus. The pain is real. The suffering is real. The experience has all the features of genuine pain. But the physical trigger, the damaged tissue, the hot stove, the sharp edge, is absent. The quality exists purely in the model. This does not mean pain is all in your head in the dismissive sense that phrase usually carries. Quite the opposite. It means that all pain, every pain you have ever felt, including the most ordinary stubbed toe, was always in your head, was always a construction of the brain's model. The stubbed toe just happened to have a convenient external correlate. The phantom limb patient does not. Every sensation you have ever experienced is a story your brain told you about the world. Usually it is an accurate story. Usually the brain's model matches external reality closely enough that you never notice the gap. But the gap is always there. You never experience reality directly, you experience a model. And phantom limb pain is the moment the curtain slips and you see the machinery behind the stage. I said at the beginning that this case is a crack in the wall. A crack in the assumption that pain is a thing that happens to your body. What I hope you see now is that the crack runs deeper than pain. The crack runs through all of experience. Everything you feel, see, hear, taste, touch is a model, a construction, a guess that your brain makes and presents to you with such confidence, such seamless integration, such vivid immediacy that you never think to question it. Until you meet someone whose brain is generating a perfectly vivid, perfectly detailed, perfectly real experience of a hand that has been buried in the ground for 3 years. And then you realize the brain was always doing this, for all of us, all the time. Matter is out there, physics is out there, atoms, forces, fields, all of it. Real and solid and described by beautiful equations. But your experience of that world is in here, in the model, in the map, and the map is not the territory. The map is painted by 100 billion neurons doing their best, working with whatever signals they get, filling in gaps, making predictions, smoothing over inconsistencies, and occasionally, when the signals stop coming from a limb that no longer exists, generating a hand made of nothing but electricity and memory and pain. If you think about this long enough, it should change the way you look at your own hand. the one attached to your body right now. Wiggle your fingers. Feel them move. That feeling, that vivid, undeniable, absolutely certain feeling of fingers moving in space, is happening in your cortex. The fingers provide the data, but the feeling lives in the map. You are, in a very real sense, a phantom, a model that your brain builds and presents to you as a self. And the model is so good, so seamless, so continuous, that you never notice it is a model at all. That is the deepest thing phantom pain has to teach us. Not about limbs, not about nerves, but about the nature of being a thing that feels. A soldier in 1866 sits in a Philadelphia hospital, feeling fingernails dig into a palm that does not exist. And in doing so, he reveals something about the physics of experience that we are still, more than a century later, trying to fully understand. If you have ever felt something that should not have been there, a presence, a tingle, a fleeting sensation in a part of your body that made no sense, I would like to know about it. Because every one of those moments is a clue, and we are still very much on the case.